Increasing suicide rate among Black male teens. Suicide is a growing health crisis among America's young Black male teens. African American males and suicide attempts. Black teens are increasingly attempting suicide, raising alarm amid a growing crisis of suicide among America's youth. Suicide, long thought of something that affected other racial and ethnic groups, is fast becoming an epidemic in Black communities, particularly among school-age Black children. Historically, Black teenagers in the United States have had lower suicide rates than whites, but recent research studies have found that more Black teens have been attempting suicide in recent years, and experts are not sure why. A recent study in the Journal of Community Health showed that suicide rates among Black girls ages 13 to 19 nearly doubled from 2001 to 2017. For Black boys in the same age group over the same period, rates rose a phenomenal 60%. Additionally, for children ages 5 to 12, Black males are committing suicide at higher rates than any other racial or ethnic group. Prevention efforts should address increased suicide risk among Black male teens, while increased suicide risk among Black females also warrants action. Rates have typically been higher among males. Depending on the age group, the male-to-female suicide ratio has ranged from 4 to 1 or as high as 8 to 1. Young Black males are the most at risk. White male suicide rate. White males have historically had higher rates of suicide attempts and deaths by suicide compared to their Black male counterparts. Findings show a concerning increase in suicide attempts among Black male teens. Well-documented disparities in mental health treatment and mistrust in healthcare providers, as well as social and environmental factors, such as racial discrimination, adverse childhood experiences, and poverty, have all been positively associated with suicidal and self-harm behaviors among Black youth. Increased self-injury behavior among Black teenage males. Moreover, research has found that self-reported suicide attempts among Black teenage males rose during the same time period examined, that is 2001 to 2017. However, self-reported suicide attempts did not significantly change among all races and ethnicities also included in the study. There was a significant increase in self-injuries related, that is, injuries from suicide attempts, among Black male teens. Overall, suicide thoughts and planning rates increased along with actual suicide attempts among Black male teens. Societal shifts and mainstream influence on Black males. One possibility for the recent increase in suicide ideations and attempts among Black male teenagers could be societal shifts are bringing teenagers more into the mainstream with their white peers, and maybe that maybe influence their behavior, and or social media, political climate could also be having a huge effect on Black male teens' interpretations and behavior. Intervention. Improving mental health services among Black male teens requires an approach that is culturally and linguistically informed. The screening process involves assessment, referral, early intervention, and treatment and support. It also requires providers to understand the culture, the Black culture, know how to engage young children and their families, young Black children and their families, and are willing to work to establish a trusting relationship, and also be able to address the community conditions that are going on that place Black children and their families at risk for mental health problems. It should be noted that mental health problems in children of different cultures, for an example, Black children, races, and ethnicities may also present differently. Call to action among practitioners. The persistent suicide trend should prompt a call to action among practitioners that work in child serving systems such as pediatric and family health care, schools, child welfare, mental health providers, and researchers. It should also be noted to take call to action for any faith-based communities that serve families and particularly help the fathers to be more involved in their children's lives. Collaboration among the aforementioned groups and/or individuals is necessary to prevent child suicide among Black children and teens, which has become critical in saving the children who endure such pain as to want to take their own life. This is considered an utmost emergency in the mental health community in America.